I think as Dr. Sue retires, it's made a lot of us think about all of her time here and what she's meant to us and to the program. And I think she's leaving a really big legacy.
Right, Dr. Sue is a force of nature as far as I'm concerned, and she has definitely advanced the field of pediatric cardiology in the many years that she's been practicing.
I'm just happy for my mom that she can look back after 30 years or whatever it is that she's been doing this and say, I've made all those lives better.
When you read her bio, you see how many different things that she has done. And in the world of heart transplant, she had her pulse on what was new in cardiology, what was up and coming, what needed research and discovery, where she could make a difference in all of it, both clinically and academically.
When you work with Dr. Sue, you really see how dedicated she is to her patients. She believes in really fighting for what's best for them. In addition, she pushes the people around her, everyone she treats the same, and she treats them as people who are expert at what their job is and that she expects the best out of them.
When I think of my mom's work, when I became older, I think I became more aware of the kids. But when I was younger, mainly what I knew were my mom's colleagues and her mentees. Everyone in pediatric cardiology seemed to be part of her family. And I think she made that as much of a family to her as she made our family. And that's, I think, wonderful.
Daphne took care of her children, her husband, and yet never faltered in her professional life. And that's quite an accomplishment. When you think of all the things she had to do that many of us in the male side could leave to others.
I've been thinking a lot about her retirement and what I hope for her. And I think too simple to say, like, well, I hope she put some of that attention that she's been giving to other people onto herself. But I actually don't think that's the right thing for Mom. I think she's going to continue to find different ways to give back to the people, give to the people in her life, and to keep the focus outward. I think it works for her. I think it's kind of her superpower.
I've met many other women in medicine who have talked about work-life balance, but Daphne really lives it in a way that I didn't always feel from other people. Daphne told me once when I was very pregnant with my twins that there was no reason that we couldn't work out a schedule where I could go to school events and be in the cath lab and do all the things I needed to do. And she told me about the year that she was the baseball coach for her son's baseball team and how she figured out how to change around her clinical schedule to be at every baseball game that year. And so to me, that always was the example of what I could do. And I think everyone else in the division knew that that was important to her.
As I look back on my career, one of the things I'm very proud of are my patients. I love seeing my patients do all different kinds of things and enjoy life and be a part of their families and grow up and have experiences that they enjoy. The fact that you get to be involved in their lives all along the way. When you're born with heart disease, there's a lot of anxiety for the family, for the patient. One of the best things you can do as a cardiologist is be that person, that constant throughout the life of that child, and as that adult to try to say, you're living with this, it's okay, you're doing a great job.
I have a congenital heart defect. I've corrected transposition of the greater vessels, so my heart is very different than a typical heart that you would learn about. Dr. Sue has helped me just absolutely amazingly. I would not have the amazing life that I have if not for Dr. Sue. She really makes it so that I can live life to the fullest. I would not be where I am without Dr. Sue. She was able to really make sure to fight for me and fight for what I needed and wanted to not only care for my heart anatomically, but my heart of my emotions and what really mattered to me. And she's always done that and really shown through to care for me.
As I think of my time here at Children's Hospital Montefiore, I think of all the people that I have worked with who are within the division, within the Heart Center, and in the whole institution. I want to say to the people who I worked with, you are the best. You are people who are dedicated to a mission. You also have your knowledge and your smarts to make sure that you can achieve the goals that you want to achieve for your patients. But you also have wonderful personalities, and the ability to work together with your colleagues is very admirable.